Hello, everybody. Welcome to another BioIT World Web Symposium. We are revisiting familiar ground today, looking at EDC, and I think we have one of our more direct titles for a recent web symposium, How to Stop EDC from Causing Sites Pain. We are very grateful to CMed Technology for underwriting today's web symposium. Over the course of the next 90 minutes, you'll be hearing from three talented speakers with a wealth of experience in managing and deploying EDC from a variety of different vantage points. So I think this is going to be one of the more constructive web symposia that we have held in recent memory. After a short introduction from me, I'll bring on the first of our three speakers. And as Elizabeth just mentioned, what really makes these symposia work is to invite as much participation and questions from you, the audience, as possible. We have a chat box. You are welcome to enter your questions at any time. Your questions will remain there, and we will try to devote as much time as we can in the next 90 minutes to having one or all of our guest speakers address your particular questions and hopefully give you some valuable feedback and answers to any specific problems or questions that you may have. So let me just set the scene for what we're going to cover today. EDC, electronic data capture, has been part and parcel of clinical trials for a very long time, certainly since predating the launch of BioIT World and our sister publication, eClinica. But since many sites are reluctant to fully embrace the inherent advantages of EDC. One of the major reasons for that is that implementing EDC, as you all know, can be a pretty painful process. So that's why we're here to discuss how to stop EDC from causing sites pain. We're going to hear from a trio of distinguished speakers representing the investigator, sponsor, and eClinical technology or vendor arenas who will share their own experiences, insights, and frustrations, perhaps, regarding the successful implementation of EDC technology. Now, obviously, our guest speakers didn't get where they are today by not being able to address some of the headaches inherent in using and utilizing EDC. So you'll undoubtedly be hearing about some of those remedies, as well as the specific pain points. And in particular, in our third and final presentation, you'll hear how eClinical platforms can provide a fast and reliable experience using cloud computing and mobile technologies to expedite trials and provide access to clean clinical data. We're going to devote time for your questions. We'll take one or two questions at the end of each presentation. So if during each of the three speakers a burning question should arise, please enter it in without needing any prompting from us. Just put it into the chat box, and we'll take one or two at the end of the presentation, but we'll save most of the questions for a general Q&A session at the end of the three formal presentations. So I do hope that you'll be able to stick around for the full 90 minutes to get as much value from the webcast as possible. Our three speakers, then, let me introduce them and welcome the first of our speakers. In reverse order, we're going to hear from Jim Howitt, who is Vice President for Commercialization and Operations at CMed Technology. In the middle, you'll hear from Margot Johnson, who is Director and Global Clinical Lead for apixaban VTE treatment. She'll tell you more about that and her role at Pfizer in the second of our three presentations. But first off, it's a pleasure to welcome back to IT World Web Symposium Series Marina Nilny, who is with the Dana-Farber Cancer Institute Clinical Trials IS team. Marina trained in mathematics and statistics at the Hebrew University of Jerusalem in Israel. She led Dana-Farber's search